Hi, I'm Denise Plante. There has been so much tragedy in the news lately. Let me give you some stats about Colorado. Over 1 million people suffer from mental illness and substance use disorder. Out of those million people, 200,000 are children. Here at Bonneville, our station groups have decided to do something different, something to change those numbers and to lift up our community. That's why we invited Andrew Romanoff, who's the CEO and president of Mental Health Colorado. Good to see you, Andrew.
Thanks, Denise. You too.
First off, tell me a little bit about Mental Health Colorado and what you do.
We're a nonprofit advocacy organization. We're not a treatment provider. We're not a government agency. In fact, we don't get any government money at all. We're in the business of trying to change two things. One is public opinion. We want more Coloradans to recognize that mental illness is not a character flaw, and it's not a figment of your imagination. It's a medical condition, and it doesn't have to be a death sentence. Mental illness is treatable. So we're trying to improve public understanding of mental health and substance use disorders, as you said, and also trying to shape public policy so that we can put a greater priority on prevention and early intervention instead of turning our jails and prisons into warehouses for people with mental illness or drug or alcohol addiction.
Is that why you think mental health awareness is so important for our community?
It is, and I'll tell you, of the 1 million Coloradans you just mentioned who experience a mental health or substance use disorder each year, half of them go without the treatment they need. That's 500,000 Coloradans. One of the reasons is because of fear or shame or stigma. People tell us all the time, I'm not comfortable discussing these personal problems. I'm worried about what might happen if someone finds out.
So Andrew, on that note, why do you feel mental health and substance use need more resources here in Colorado?
Well, the truth is Colorado ranks in the bottom quartile of the nation when it comes to the number of psychiatric beds per capita. Just to take one example, we have one of the nation's highest suicide rates. We have more folks with drug or alcohol addiction than most states of similar size. So we're not doing a particularly good job, it seems to me, in preventing these disorders from taking shape. We do a good job when an emergency hits. We band together, we rally the troops, we respond in times of crisis. But when it comes to prevention and early intervention, there's far more we could do, especially when you consider the fact that in most cases, the first signs of mental illness occur during adolescence.
You know, I want to talk about your story, if you don't mind. I've known Andrew for a couple of years now, and you actually started in mental health awareness because of something very personal to you.
Yeah, you know, I worked on these issues when I was in the State House, but it didn't hit home until about 3.5 years ago, at least not as personally. I had a kid sister. She was actually my first cousin, closer to me than anyone in the world. She could afford medical care. She had a job that carried insurance. But what we didn't know, because she didn't tell us, is that she was suffering from a very deep depression. At least that's what I think it was. I can't ask her that question anymore because 3.5 years ago, while my little cousin and her mom and dad and I were celebrating the New Year, she walked into the backyard and shot herself to death with no warning. We're going to spend the rest of our lives as a family trying to figure out how we missed the signs of her mental illness, and we'll never know. I joined this organization, Mental Health Colorado, not because I thought I could somehow bring her back to life, although I would do anything in the world if I could, but because I knew that we're not alone. I knew that more than 1,000 Coloradans die by suicide each year.
It's so sad, and it's affecting our youth. You know, I tell my boys, both in high school, this is just a little bit of your life. I mean, it means nothing. You have the world in front of you. You're not even going to think about this issue a year from now. But everything is so deep to them at that age. And then you're right, they're suffering from depression. They're suffering from anxiety. And there's so many pressures on them today from when we went to school. Yep. We didn't have social media.
That's true, and I'll tell you, suicide has become the leading cause of death among adolescents in Colorado. We have, as I mentioned, one of the highest suicide rates in the nation. A lot of folks will tell you suicide is a permanent solution to a temporary problem. It's often an impulsive decision. So we ought to do absolutely everything we can to try to reduce that rate, try to get more folks screened for mental health disorders, try to get more mental health resources embedded in schools, try to reduce the rate of suicide. And the truth is we can. There's no reason that Colorado has to have one of the highest rates in the nation.
We can change that. And like you said earlier, people are afraid to tell other people that they're suffering from depression or that they suffer from anxiety. I shared with you, I have anxiety. You know, I have to take medication for anxiety.
Right.
And it's strange that I put myself in the spotlight, but I think it can affect anyone, and you don't have to be embarrassed about it.
That's a really, really important point. So thank you for sharing your story. We've created an online story bank at mentalhealthcolorado.org in which people tell what it's like to live with a mental health or substance use disorder, or to care for a loved one who has had a similar experience. We find one of the best ways to destigmatize and demystify mental illness is to meet someone who's gone through this experience.
Right.
In many cases, of course, we're talking about chronic conditions for which you might need treatment for the rest of your life. But the point is, you can get help. These conditions are treatable, they're manageable, and you can lead a healthy and productive and rewarding life with a mental health disorder, just as you can with any other physical condition.
It's okay to talk about it. It's okay to get out and get help. I want to find out how we can get involved with the work that you're doing. You're reaching out into the community and you're changing lives.
Well, thanks. Yeah, we'd be thrilled to have help. Folks can join the Brainwave. We're building a network of advocates across the state. We call it the Brainwave. You can learn more at mentalhealthcolorado.org/brainwave. We're looking for champions in every community, people who will stand up and speak out on behalf of mental health care, as you are doing, who will help us persuade lawmakers, whether they be state legislators or county commissioners or school board members, to make investments in mental health care. So that's one way that people can take part.
All right, and if you had one wish in life for Colorado when it is in regards to mental health and then also substance use, what would that wish be?
Well, my wish obviously is that everybody in Colorado who experiences a mental health or substance use disorder gets the care they need. We're not there yet. I'd like this state to become the national leader in this field. I'll give you a little spoiler alert. We're not there yet. We rank 43rd by last count.
You're kidding.
Totally unacceptable. I wish I were. I mean, Colorado is one of the most highly educated and affluent states in the union. There's no reason on earth that we couldn't lead the nation in the prevention and treatment of mental health and substance use disorders, and no reason that we have to lag the nation as we do at the moment.
You know, it takes people to stand up and have the courage to actually have that conversation and to get help. I know sometimes it can be a scary moment in your life, but you don't have to suffer. You don't have to live with anxiety. You don't have to live with depression, and you don't have to live with substance use disorder. Pick up the phone, also give Mental Health Colorado a call, and Andrew Romanoff and his team will be happy to help you. When it comes to kids, let's talk about mental health. Should we start at a very young age?
We should, because that's when mental illness starts. In many cases, these conditions are genetic or biological in origin. Sometimes they're the product of adverse childhood experiences, things that kids go through, for example, between birth and 5. It's one of the reasons that we're developing a pair of toolkits, one aimed at schools. So what can you do as a school today to train teachers and other staff to spot the early warning signs of mental health or substance use disorders? How do you screen kids? How do you engage parents and families in this conversation? That's key. How do you put more mental health professionals on staff? And how do you pay for all of that? So one toolkit, which you can find at mentalhealthcolorado.org/toolkit, lays out best practices for school-based mental health services. Another toolkit that we're developing aims at early childhood strategies. So what can you do as a pediatrician or a child care provider or a parent with a kid between birth and 5? What works to mitigate the effects of those adverse childhood experiences and help improve childhood well-being? Talking
to my teenager after the latest horrible, tragic news from another high school in Texas, I was talking to my teenager about it, and I said, what can we do? What is going on? And he felt like, you know, of course there's mental illness, but there's also a hierarchy in school. And if it started at a young age like kindergarten, and the teacher would look at the class and say, okay, what do we all have in common? And each student can say what they have in common, and then maybe team up those kids together, maybe the shy one with the popular one, and make them feel like they have something in common, then they would grow together. Do you think that would actually work?
I do, and I'll tell you, first of all, it's a good reason for you to listen to your son if he's watching. Just, you know, make sure your mom takes your advice. But yes, I think making social and emotional learning approaches like the kind that you just described part of every school culture and curriculum, embedded in the school budget. Some of the stuff we're talking about shouldn't cost money at all.
Right.
But making sure that kids have the benefit of those sorts of services will improve their chances of graduating and reduce their chances of being absent or suspended or expelled from school.
You know, Andrew, over and over with radio and TV, I have women that will come up to me and they're like, how do you do it all? And you have kids. You know what? I don't do it all. And I have issues every single day, like we talked about, with anxiety and with other issues in life. So it's okay to reach out and get help. And I really want to encourage you to reach out to the team over at Mental Health Colorado. That's what they're there for. And we are going to change one person's life at a time. And hopefully, we'll change the numbers here and we'll pop up to number 1 instead of 43rd in the nation.
That would be an improvement.
Yes.
I'll tell you, if folks want to take one other simple step, they can find this online as well. You can get screened. We want to make a mental health screening just as routine, just as normal as getting your blood pressure checked when you go to a doctor's office. So we put on our website at mentalhealthcolorado.org/screenings 11 self-assessments, questionnaires. These aren't formal diagnostic instruments. They're just quizzes you can take if you're going through what might be an anxiety disorder or depression. We put up a screening tool for parents to take if they're worried about their kids. We put up one for kids to take if they're worried about themselves. So you answer a series of questions, and then the screening tool will say, hey, you might be going through the experience of mild depression, and here are some resources to which you can turn for help.
Excellent, excellent. And that's mentalhealthcolorado.org.
/screenings.
/screenings.
Yes.
All right. Well, we are owned by Bonneville,
Right.
which the cluster of radio stations here, Cozy 101, KYGO, The Fan, ESPN. And Bonneville is all about uplifting the community and doing what we can to help others. So what you're doing, we praise you for it. Thank you for helping our future of our kids and, of course, the adults here in Colorado.
I want to, in return, say thank you for giving us this opportunity. We hope everybody will tune in and obviously log on, mentalhealthcolorado.org, get the resources you need to improve your own well-being or a family member's.
Thank you. Now, Andrew, I want to end on a happy note. There has to be some story you can share where someone reached out, they got help, and they're living life to the fullest.
There are a lot of stories like that. I'll tell you one that's near and dear to me. I have a twin sister. She is 7 minutes older than I am, which she will tell you were the best 7 minutes of her life because she's a brat.
Yes.
And she suffers from depression. In her case, the depression was so deep at one point that she cut herself off from our family for 4 years. I didn't talk to her, neither did my mom or dad. But then my sister sought help. She got treatment. It wasn't easy. It wasn't automatic. It wasn't overnight. It was a process, as is so often the case, of trial and error. For my sister, it's meant a combination of counseling and medication. But I'm here to tell you, it's working. Having not talked to my sister for 4 years, I hear from her now several times a day. I tell people the treatment was too effective. And I joined Mental Health Colorado because I wanted fewer stories to end in tragedy and despair, and more stories to end like my sister's in hope and treatment and recovery. I think we can make that possible.
We can. That's a great story. I'm so happy she's doing well.
Me too.
So let's make a difference. Thank you to Mental Health Colorado. You can go to mentalhealthcolorado.org and help Team Bonneville lift up the community and really make a difference.